That's right. The hospitals are simply overwhelmed with so many COVID patients. The state health officer said today there are no ICU beds in the Jackson Metro. Central Mississippi hospitals are in critical condition because of the pandemic, according to State Health Officer Dr. Thomas Dobbs.
Dr. Dobbs is not prone to hyperbole. He's a very level-headed guy, and what we're seeing is a very, very bad situation.
Dobbs tweeted Thursday, there are 0 ICU beds in Jackson, very few elsewhere. Please protect yourself and your family. According to State Health Department data, 588 ICU beds were in use across the state Wednesday. That number includes 194 COVID patients. That number is still down, though, from more than 300 COVID patients during the huge summer spike.
We see a very disturbing trend that we've already seen once before in the summer, and we know where this goes.
Mississippi State Medical Association President Dr. Mark Horn believes the shortage of critical beds could have dire consequences.
And it's not just those who have COVID-19 that are going to suffer. It's the people who were in the car crash or who were involved in a shooting or who just got plain old pneumonia or they had a heart attack or a stroke. Those people are going to suffer right along with the patients who have COVID-19.
We reached out to all Metro hospitals to find out how they're managing in this crisis. Most haven't responded to our calls. A spokesman for the University of Mississippi Medical Center said its ICU beds are always full.
The average length of stay for a critically ill COVID patient is much longer than the average ICU stay.
Even before this, some doctors were calling on Governor Tate Reeves to reinstitute a statewide mask mandate. This week, the governor extended a requirement for face coverings in 15 counties where the deadly disease has been increasing the fastest. Dr. Horn says if Mississippians follow simple science, it could help ease stress on hospitals.
We need to slow down. We need to avoid gathering in large groups. We need to wear a mask when we're in public. We need to limit the number of times that we are in public that we don't need to be there. These are voluntary things we can all do with or without a mask mandate.
Now, the governor's mask mandate in DeSoto County is getting pushback. That's the state's third largest. According to media reports, the sheriff there says he doesn't plan to enforce it. This comes as the hospital there says its ICU is now full, and they're now scrambling to add 12 new critical care beds to handle the growing demand. Live in Jackson, Ross Adams, 16 WAPT News.